everybody, I'm Katy Sen. I work at Messerli Kramer. I'm one of the lobbyists for Safe Passage. And Courtney, do you want to introduce yourself?
Sure, and I'm Courtney Jasper. I work with Katy Sen at Messerli and Kramer, and I'm also working with Safe Passage this year.
Thanks, Courtney. And Courtney is a new face to our team, but she's not a new face at the Capitol. I mean, she's a new face to Safe Passage, but she's not a new face at Messerli or at the Capitol. She's going to be a great addition helping us this year on our legislative priorities. So I'm just going to spend a few minutes kind of giving a high level preview of the legislative session, what happens in a budget year, kind of what the calendar looks like and what the flow is for bills moving through the legislative session. Then Courtney's going to talk a little bit about some of the House and Senate priorities. You probably know that they're controlled by different parties, and so they have pretty different priorities. And she'll talk a little bit more about committee chairs and how committees are going to be different after an election. Committees always are adjusted. So then Rich will talk a little bit about Safe Passage priorities. And we can talk more about the outlook for those. Courtney and I will weigh in on that too. And hopefully we'll have plenty of time for questions. So please, if you've got questions, keep them in mind. So that makes the discussion more interesting, and we'll try to keep our portions shorter so that we have time for that. So this is a budget year. Every other year, the legislature has to pass a biennial budget or a 2-year budget. If they do not pass a budget by June 30th, then they go into shutdown. I'm sure you've heard in some years that has happened and they've gone into July. You start hearing about state parks closing and other impacts potentially. Hopefully that will not happen this year. 2 years ago, this exact same group of leaders successfully passed a budget. And so hopefully they can find a way to do that again. There is a deficit projected right now for the biennium that they're looking at, that the next 2-year cycle starts on July 1st, 2021 and goes for 2 years. That although there is a forecast that will come out in February, and so far the revenue notices that we've seen come in show that revenues are actually above what has been forecast. And so it's possible that deficit will be smaller. There's some chance it's actually erased, depending on what's happening with revenues. And one thing that Department of Revenue has been talking about that's sort of interesting is that the sale of durable goods has really gone up significantly, and sales tax is charged on durable goods, unlike services. So when you get things people had been spending money on, like vacations and haircuts and entertainment, a lot of those things are not taxable. But when you go to IKEA or buy home office furniture or, holiday decorations, all the things that I think kind of went into overdrive this year, those things are taxable. So there's some interesting things that are actually driving the state budget and could end up producing more revenue, despite the fact that there's some parts of the economy that are still really suffering. So that's something interesting that we'll be looking at. The February forecast comes out usually the last day or two of February, and that's what the legislature bases their budget on. And so they really won't be able to begin in earnest on that in a lot of depth until they get that number. Conversely, the governor's budget is due by January 26th. So he goes first, and he bases his budget on the November forecast. And so his budget, he needs to address a deficit in that two-year biennium that's coming up. And we know he's asked state agencies to propose potential places to make cuts and find savings. And that doesn't mean that he wouldn't also be looking at revenue raisers, but I think he's likely to do a mix of both. And so we will probably will see cuts in some areas in his budget. I know they're trying to make them surgical, but it would not surprise me if we do see some cuts in his budget, which we'll get to see very soon. So next year is a bonding year. Once you've passed a budget, unless you're dealing with a deficit, you really don't need to pass any other additional spending. So if there's a surplus, they can spend it if they want to in a bonding year, or they can just let it fall to the bottom line if they can't reach agreement. And that's happened several times where they've tried to come to agreement on spending when they have a surplus and aren't able to, and it just sort of falls to the bottom line. We're also lucky in Minnesota that we have a significant state surplus that we can draw upon. I think we're probably better situated than most states because of that. So we'll all be waiting. The February forecast this year feels more interesting than usual, just because of the fluctuations in the economy and wondering how that's going to impact things. So the governor's budget is kind of the next big thing that'll happen. And in February, the February forecast comes out. The other thing, deadlines that we look at really closely in the legislature are the policy and finance deadlines. And those kind of dictate when bills can keep moving. It's a way for the legislature to try to narrow, thousands and thousands of bills that are introduced through the process to figure out which ones are going to make it across the finish line. So the first two deadlines really relate to policy bills. The first deadline is that a policy bill needs to pass at least the House or the Senate, get through all the committees that it needs to go to in one body. If a bill doesn't go through either body, it dies. The only way bills, as folks at the Capitol learn quickly who work there, bill is never really dead. It can always be added by an amendment somewhere, sent to Rules Committee, but the path gets a lot more complicated and needs more buy-in if you don't meet these deadlines. So the second deadline is that those policy bills have been heard in both committees, or in both bodies, both the House and the Senate. And if you've been heard in both the House and the Senate in your policy committee by the second deadline, you're sort of in play for the end of session. And those policy bills, in theory, go to the floor either on their own or as omnibus policy bills. There's often a lot of pushback from putting policy in finance bills. And every year it happens, and depending on who's in charge, sometimes they're full of policy and sometimes there's no policy. But often those bills can travel on their own to the House floor and be passed all by themselves and not part of an omnibus bill. The third deadline is the finance deadline. And that means if a bill spends money, it needs to have gone through all of the finance committees, passed through all the finance committees and to Ways and Means by that third deadline. And there's always a negotiation between the House and the Senate about when these deadlines are. And that really relates to how much time do you leave at the end of session for conference committees and to pass bills off the floor. The legislative session has to end by May 17th. They can only come back after that in a special session if the governor calls them back. So their goal is to get this all done by May 17th, and then working backward, they have to have time to pass finance bills off the floor, usually about 10 omnibus bills. They have to go to conference committee, reach agreement with the governor, and then pass off the final conference committee reports. So the last month and a half of session, they're usually on the House or Senate floor most of the time, versus right now, they're really in committee almost all the time. They're on the floor they call it moving paper, which essentially means they're moving bills between committees and making sure that they're meeting those committee deadlines for all the different places they need to go. Some bills go to 1 or 2 committees, some bills go to 8. So it's really important at the beginning of session to figure out what are all the committees your bill needs to go to, and how do you get it to all those places before the deadlines happen so that your bill can stay alive. The House and the Senate budgets are really usually come out, it depends on the deadlines, but the omnibus finance bills are something as soon as those come out, we're all reading them very carefully to figure out kind of what got funded in the House, what got funded in the Senate. If they're the same and the governor also has it, which doesn't happen very often, but if it's in all 3 places, that's something you can, assume has a really good chance of passing, assuming that there's revenue and that there's sort of an overall agreement. Sorry. Thought I had all my notifications off, but I always miss something. And so, in April is the timeline when we often see the House and Senate omnibus bills and get to really see what they've decided to make it across the finish line. So I'm going to stop there and turn it over to Courtney to talk a little bit about priorities and committees.
Perfect. Thank you. And thank you all for inviting me to be a part of the conversation today. I've really enjoyed my time thus far working with Rich and Safe Passage. So as Katie said, I'm going to be talking to you about what session is going to look like and what committees are starting to look like. And I'd like to start by reminding you all that in Minnesota, we're kind of weird. For some reason, we were able to remain the only state with divided government. We continue to have a Republican majority Senate and a Democratic majority House. Both of the margins in the House and the Senate got much smaller this year. Currently, the margin in the Senate is 34 Republicans, 31 Democrats, and 2 Democrats deflected from the party to become independents, and they're starting to caucus with the Republicans, and they've received chairmanships from the Republican Party. So the margin in the Senate is 34-31, and then the two independents. And then in the House, it is 70 Democrats and 64 Republicans. So there's going to be a lot of need for compromise because no one has a large majority. So often at the beginning of session, we look to bill introductions to try to understand what the House and the Senate's big priorities are going to be, because those will be their first bills that they introduce. This year, it's been a little odd because with the revisers having to work remote because of COVID and with all the special sessions, they weren't able to start drafting bills as early. So there's only about 150 total bills that have been introduced in the House and Senate thus far, which is much less than usual. But we're still able to kind of tell what the House and Senate's priorities are. At the moment, the bills that have been introduced in the House have largely focused on earned sick and safe time and housing assistance and rental assistance. And in the Senate, many of the bills that have been introduced have been focused around limiting the governor's emergency powers. And some of those bills have been bipartisan. So that'll be something that's interesting to watch moving forward. And as Katy mentioned, at the beginning of any legislative session, there's a switch up to committees. This year, the House reduced its committee numbers from 34 to 30. They consolidated some committees and created new committees. And in the Senate, they actually increased their total committees from 21 to 29 committees. The Senate did that while also making many of their committees much smaller than they had been in the past. And much of the reason they did this is because they're hoping that later in session, maybe towards the spring, that they'll be able to hold committees in person, and it'll be easier to do that with distancing and with shields between bodies if there's less bodies in the room. And so they have reduced their committees, committee size substantially in the Senate. On a call this past week with the chief clerk of the House, he indicated when asked that even if somehow all of the members of the House receive vaccines and much of the public receive vaccines, there will still be no one attending in-person hearings in the House. No members, nothing. The House actually did their very first floor session hybrid. During these special sessions, they had members calling in. They spent the money on new technology now so that members are able to stream in via Zoom, and some members are attending in person. They have a mask mandate in the House that does not exist in the Senate. And they also invested in it feels silly to call it a thumb drive because it is a thumb drive, but also members use their thumbs in the House to indicate and verify that it is them voting. So they're able to virtually vote instead of having to call in and go through all 34 members of the House one by one voting yay or nay on each bill. So that'll speed things up. And that is something that those of us that have been watching the House are really looking forward to. So like I said earlier, there are new committees, 2 new committees of interest to safe passage that we've been talking about. They split up Health and Human Services, Finance and Policy in the House to have a Human Services, Finance and Policy and a Health and a Health Services, Finance and Policy. And the new Human Services, Finance and Policy Committee is chaired by Representative Schultz from Duluth. And then in the Senate, they split up the Judiciary Committee and created a new Civil Law and Data Practices Committee with Senator Matthews from Princeton. And so moving forward, those are committees that we're going to be watching, and those are chairs that we are meeting with and having conversations with moving forward to introduce them in their new positions to safe passage and to our priorities. And with that, I think I will send it over to Rich.
Okay, thanks, Katy and Courtney. I'm going to cover a couple of things here, and then I think you guys have some follow-up after that, and then we'll get to the discussion part. But I just want to say I see a lot of people who haven't worked with us before, and I want to just reinforce what Stephanie said, which is we'd love to have you, if you're interested in these issues, volunteer with us. So it's pretty interesting. It's not that stressful, and it makes a huge impact, because the reason that we've had, a significant impact at the Capitol is because of because of volunteers, because you are all somebody's constituents, you're the apple of somebody's eye, and when you call for an appointment, you'll get it. We'll help you get that appointment, but the point is they want to talk to constituents, not nonprofit directors as much. So you really have an outsized impact if you work with us on some of these issues. So I just want to reinforce that. Either put something in the chat box right now or send an email to us. It's just contact us at safepassagemn.org. So one thing we're going to do this year is continue with our agenda from previous years, which is to modify a number of existing social work practices in what's called the Family Assessment Program. For those of you who don't know about it, there's two tracks in child protection. One is the traditional investigation and one is family assessment. And just to share with you, and if you want, just email us and I can send you this document. But the last couple of years we've introduced a bill and it had really 5 components to it. These are components that were originally recommended by a governor's task force on child protection in 2015 and which have not yet been implemented. These are practices that we think are critical to child safety. We think that it's dangerous to do these practices, dangerous for children. And we've got quite a bit of new research that is supporting that. And, just a lot of support from, many parts of the system, parts of the child welfare world, I should say. So I'm just going to talk about these briefly to give you the flavor. And again, if you want to see more detail, just track us as we go through the volunteer process and getting ready for the session, or email us and I can send you this. One is to interview children separately from and prior to the adults during the initial child protection visit, unless there's exceptional circumstances. This is a change this is something which many states do, and also the federal courts have required this change in practice as part of a class action lawsuit in Hennepin County last year, or 2019. So it is standard practice in most places. It's common sense to not interview children in front of the adults. Secondly, don't give advance notice of that initial child protection visit. So we eliminate the opportunity to coach children, intimidate them, tell them what to say. Third, to train child protection workers in fact finding and do this before signing cases. If you're not familiar with the field, you would assume that people always do fact finding in child protection reports, but that is something that has not been a part of family assessment. And we think that makes it difficult, to say the least, to figure out what's going on and if children are safe. Fourth, in these family assessment cases, to write up the information about what the worker found in case notes and put it in the computer. So if there's another report in the future, those workers who get the case assigned then know what happened. And so that's the 4 that were in the original recommendations from this task force that I mentioned. And finally, to interview foster children also 4 years and older separately from the foster parents. And again, that was something that the federal courts required for Hennepin County in that class action lawsuit. So those are some of the, that's one thing we're going to do. We're not sure yet whether we'll get a bill again, as we have in past years. But even if we don't get a bill, we're going to continue to educate legislators about this. And we're going to continue to, be, working on this until such time as we get these set of practices changed. There were many other practices that were recommended by this governor's task force, but these are 5 of the most important in terms of child safety. So that's part of our agenda, and the rest of our agenda is not as clear, but I'm going to share with you. We've been working with a number of partners and with other organizations on legislation. There's an organization, an institute at Mitchell-Hamline Law School called the Institute for the Transformation of Child Welfare, or something close to that. And they've been working on a bill for a couple of years, which would lower the barriers to becoming a licensed foster parent by essentially saying that if a person had a felony at some point in the past, that we're going to reduce the length of time before they can be considered as a foster parent. And so we've been working to get that bill to the point where we think it's child friendly. And part of that is to recommend, and we don't know yet whether this will all go through, recommend that we develop much more clear criteria for counties to use when they're evaluating potential foster parents, because we think it's very inconsistent around the state as to how prospective foster parents are evaluated. And we think it will actually be more fair to people if everybody's using the same set of criteria to assess foster parents, and they'll be able to evaluate whether a person has, if they committed a felony in the past, if they've rehabilitated, if they've been in the community, and if they're really a good candidate for kinship foster care or regular foster care now. And I think that there's some concerns about, these parts of our agenda that they'll end up with more Black and Brown and Indigenous children getting screened, and families getting screened into the system. But our overall point of view is, we're very concerned about, racial disparities in the system as well. So we need a system that's a lot more clear about which children and families should be screened in and which ones don't need to be screened in, so we get the right kids protected and we don't get families unnecessarily in the system. So we're all kind of, working together on that common set of common grounds. There's another initiative out there that we may be involved in called by a guy named Mark Gordon, who is a recently retired president of Mitchell Hamlin Law School. And he's brought together a very large contingent of people from across the political spectrum with the goal of eventually introducing some legislation to substantially increase the amount of prevention funding in child welfare and child protection and foster care, so that not as many families end up in the system to begin with. And I think he's got a pretty good process and a pretty good product, but this is just not going to be a year when you can get, millions of dollars in new funding unless something happens. But he may introduce a bill and get that started, and then we would be, helping him to promote that, because of course, if families don't need to be in child protection in the first place, everything is, better. We've also been reaching out to people in the early childhood world and targeted home visiting. These are two services that have been shown by research to significantly reduce the number of families that end up in child protection, because there's a reduction in child abuse. And so if you can, prevent child abuse, then again, everything is better. We've heard back and are talking with the early childhood people, and we understand they are going to, again, propose increased funding for early learning scholarships, which is probably the best tool to help both prevent child abuse and also to support families once they're in the system. So we have supported that every year, and we'll continue to do so. Again, they're unlikely to get a big chunk of money this year, but they want to keep that conversation going. Then I want to say that next time, our next webinar 2 weeks from now, we will have Representative Dave Pinto, who is the chair of the Early Childhood Committee in the House and pretty much the acknowledged leader of early childhood issues in the legislature. And so he will be talking about what's coming up in the early childhood world, what initiatives there are, what his favorite legislation is, et cetera. So that's 2 weeks from now. Longer term, we have, some of you may have attended our series in the fall, our webinar series on COVID. We had 3, and there was a couple of presentations, one in particular by a guy named Andrew Campbell, and you can still go back and look at that presentation if you want, where we went over some of the really, I think, stunning research about the overlap among child protection, animal abuse, and domestic violence. And there's basically, it's a, if you have 3 interlocking circles, they're all 60% or more overlapping. And essentially, if those 3 fields were operating more closely together, you could probably pick up 90%, I'm being told by some of the experts, of child abuse situations as much as a year sooner. So we've started working with the animal rights folks, and we're trying to engage and get the domestic violence people interested. They're a little more concerned nationally and locally about other people reporting domestic violence, because they want the person who's the victim to be the one in control of reporting. But we're going to be trying to build a coalition this year. We'll see how it goes among those 3 fields so that we can have some common proposals in future years. And finally, just to, we are having, we had a series of conversations that Katy actually got us going, got us connected with the key people in the Minnesota Department of Education, Department of Human Services, and the Children's Cabinet around what's going on with kids being out of school, and all of the damage that's being done to kids developmentally, and also many of the children who are victims of maltreatment being hidden from view because teachers aren't seeing them and reporting them, and really encourage them to make schools safe so that children and teachers can go back, and also some ideas about how to communicate among those sectors that are seeing kids, but they're not the traditional reporters. So we had some good conversations there, and then the governor did decide to, allow local districts to have in-person instruction starting later this month. I don't know how much our conversations weighed into that, but we were very pleased to see the governor make that change. I see today that the teachers unions in St. Paul and Minneapolis are opposing that, so we'll have to continue to work with them. But all the research and the American Academy of Pediatrics and our own Michael Osterholm, who many of you know because he's our kind of national representative on Biden's coronavirus task force, and just the research has basically all shown that schools can be the safest place in the community if they follow the certain practices, and children desperately need to get back there for so many reasons. So those are the people we've been working with. In addition, some of that's legislation, some of it's policy, but your input really is the engine that drives us and that gives us credibility for raising these issues at the Capitol. So again, thanks to those of you who already chatted that you're interested in volunteering, and please consider that again. So that's our overview. We can talk about it more later, and may have gone on a little long, but then back to you, Katy and Courtney, for the rest of the presentation.
Yeah, I think Courtney and I were just going to kind of give a lowdown of what we see, sort of the strengths and the challenges going into this session, kind of thinking through on those particular issues. So I'll give a couple thoughts, and then Courtney can give thoughts too. I mean, I completely agree with Rich that volunteers are really one of the huge strengths of this organization. And, Rich, for those who are maybe new to the call and new to learning about Safe Passage, Rich was one of the main drivers behind Governor Dayton's Child Welfare Task Force. And I see Lisa Hollensteiner, and I know there's other people on this call that were probably, really instrumental in that and those proposed changes. Those were huge sweeping changes to the system that had, more than any that had been made in many, many years. And so now I think the system is adjusting, and there's a little bit of a backlash trying to figure out, well, all these new kids came into the system and so many of them were kids of color, and should they be in the system or should they not be in the system? Are they there because of, because of the people in the system have a racist lens on who they're deciding to pull out? So it's a really important conversation that's happening right now, but it's in response to some pretty significant changes that Rich helped make in response to some children that had died across the state, and Governor Dayton pulled the task force together and said this can't keep happening. So kudos to Rich for really having that impact. And it's figuring out kind of what's the next step forward. So the volunteers that come talk to legislators, and Rich's voice, which is well known at the Capitol, are really important to moving that ball forward. We also, some of the volunteers are real high profile folks that have great connections at the Capitol, and some are just regular constituents that can get meetings with their legislators and tell a powerful personal story about being a worker in the child welfare system or being a foster parent. Those individual stories are extremely powerful. Another big ally we have is Julie Rosen. She was on the Child Welfare Task Force with Rich. She's been our chief author. She's the chair of the Finance Committee in the Senate. She was the author of the Viking Stadium that got passed. She was the author of the opioid bill that passed. She's sort of known for doing difficult, hard legislation that requires coalition building and requires listening. And so, having her on board, she introduced our bill last session. And I think we're continuing to talk with her about, how do we address some of the concerns that folks have, and is there a pathway forward? So those are some of the things we have on our side. I think this year, because of COVID, just everything's going to be more difficult. They've encouraged legislators to introduce only the bills they really truly want to pass and think can pass, or that are focused on getting a budget. And so it's going to be very difficult for everyone who's trying to push anything that's not related to COVID or that's not related to having a biennial budget this year. And it's just slower. You know, as Courtney mentioned, the bill introductions are slower. The committees are smaller. They're meeting remotely. There's no hallway conversations. So it's just going to be more difficult to get things done. And we saw that during all the special sessions, kind of how that slowed things down. And if there's a deficit, you know, that always makes things harder too. Even things that, you know, it's easier if your bill doesn't cost money, which ours does not. So that's a good thing. But legislators are just really focused on the budget this year and getting that done before May 17th. So those are some of the things I would mention. Courtney, I don't know if you have any other things to add.
Yeah, I mean, I would mention most, if not all, of what Katy said is very important. And with our understanding of how difficult it's going to be to pass things that aren't directly COVID related and aren't directly budget related, we are going to spend a lot of time this year introducing Safe Passage and Rich to a bunch of new members. There's 30 new members in the legislature that we need to get in front of and meet and introduce them to Safe Passage, so that when there are conversations, because there's going to be conversations about schools and there's going to be conversations about child welfare concerns, so that he's someone, and Safe Passage is a group that they can turn to and check in on when they need advice on these things. So we're going to work on making sure that Safe Passage is a name and a face that people reach out to when they need help in this year. And so we're going to spend a lot of time on relationship building. I think that's going to be very important.
You know, that reminds me of one other thing I forgot to mention. We also work with the media around, you know, trying to keep these issues front and center. There was a series on Channel 5 about Autumn Hallow, who was a little girl who was killed late in the year, starved to death over a period of time while the authorities were busy doing other things. And, you know, there were multiple red flags and nobody responded. So they covered that. And also on Tuesday, I think it was this week, Chris Sears of Star Tribune, is one of their major reporters, did a really substantial story on being out of school and the impact that has on child maltreatment. We're going to be sending that out to all our subscribers, and we'll put it on the website. So that's another thing that we do, is we try to keep the media kind of engaged on this issue.
So we're happy to take questions, unless Rich, if you have anything else.
No, I was just going to say, this is the part where we just open it up and, you know, people ask their questions, and don't be shy, even though we're on Zoom, because it's very informal. We've had some really good discussions. So once you throw something in there, you usually get some response, and keeps the conversation going. So please, you know, just weigh in with whatever questions you might have or comments.
I have a question. This is maybe a little bit off the topic, but I'm kind of wondering, you just mentioned Autumn's death. Is there these children? We most recently heard of a 3-year-old that parents were arrested. St. Paul, was it? I'm not sure. Anyway, are children, these deaths being investigated and somehow interfacing with what we're doing? I mean, how does that affect? Are they known to Child Protection? Are they, you know, because this is additional data of children that are dying.
Well, Phyllis, you know, you may remember some of these from past years. Phyllis has been with us since the very beginning. So if there was like a, you know, a legacy award, you know, Phyllis would get.
Yeah, that's true.
and your husband, Bob. But yeah, it's a mixed bag. Basically, many of these children are known to Child Protection, but sometimes you can't figure that out because the only source of information you have is the media report. Now, according to legislation, the law says the counties have to do a report on all child fatalities, you know, from maltreatment, not, you know, if the child died of natural causes or, you know, whatever, and make it available 30 days after they complete the report, unless there's still ongoing prosecution, right? Well, one of the things that happened that kind of kicked off that whole task force that we were talking about in 2015 is the Star Tribune followed up on pretty much all of the child fatalities from 2003 to 2014. And there were, I think, 53 of them. But to get the information that is supposed to be freely available from the counties, they had to get a bunch of lawyers to you kind of beat on the counties. Whenever Safe Passage tries to get that information, we'll get, you know, a one-page summary from one county that doesn't say anything. We'll get the full report from another county that really we can figure out what happened. We get just pushback from a third county that says we're not giving you anything. So we went to the state and said, hey, they have to give all this information to the Department of Human Services. Why don't you, once you finished your review, you know, just make the reports public? Well, there was a lot of rustling in the back room for a couple of months, and finally their lawyers came out with this very lawyerly statement saying, no, we don't have to do that. So you don't get, it's really devilishly difficult to get this information. And we have a, you know, in the back room, we have a legislative agenda for when we get these first pieces passed that includes making this information public. On the other side of the ledger, the Department of Human Services has, a couple of years ago, they instituted a new review process for child fatalities. I can't think of the name of it, I'm sorry at the moment, but is based on hospital quality improvement programs and improvement programs in aircraft industry, things like that nature. And I'm fairly familiar with quality improvement, you know, the world of quality improvement because of, you know, work I've done. And it's a pretty good program in my view. They've got this basic idea is most of these errors are systemic in nature. They're not because of the individual mistakes of the worker, because the worker really pressures people to keep kids at home to the point where they probably shouldn't, but they're just getting a lot of pressure from management, either for budget reasons or because of the family assessment model to leave kids and to return them to situations 5, 10, 15 times, you know, before they finally give up and begin to start on, you know, removing the kids permanently. So those are systemic reasons. And what this process is supposed to do is look at the system and not, you know, scapegoat the workers. So the concept is great, but they're not really, in my experience, looking at things like, well, is the policy off here? Is there something wrong with the policy that tries to keep kids at home no matter what? So the theory is great. The practice, you know, is not as good on the new system. And, you know, as I say, very difficult to get, there's very little transparency about child fatalities. So in transparency, what you want to know is, hey, how many times was that child reported to child protection before, or if ever? Were they known to other authorities who didn't cross-report to child protection? Have they been in foster care? You know, those kind of questions to know if, you know, if better practices could have prevented the death. But you can't get that information now unless some enterprising reporter digs it out. Yeah, exactly. My reaction, exactly, yeah. Greg, I just want to make sure gets introduced as one of our board members and a retired child protection supervisor who spent many years in the system, so a real expert here.
If I understood you correctly, I think you may have been referring, at least as one of the examples, of the 2-year-old child that was found dead on the porch over in St. Paul, where both parents were arrested and the other children were placed in out-of-home placement. Based only on what I saw in the newspaper and on the news reports, and side comment, while I don't think any of the media ever deliberately provides false information, they don't always provide full information, and oftentimes they don't have full information. That being said, the article that I read did say that the children had been in foster care and had recently been returned to the parents. So that means that there would have been a juvenile court involved, and a juvenile court judge had authorized the return of the children to that home.
And then it also said that the landlord was there doing some repairs that same day and was so concerned he reported to child protection, but that was just 12 hours before the death. In the case of Autumn, just to go to the other one, she was starved to death over a period of 6 or 8 months because she wasn't in school, and the mother was frantically trying to get somebody to take a look at it. So the police did do child welfare checks many times, but they never actually laid eyes on the child. So there's a policy thing, which is, you know, if police are doing a child welfare check, they actually have to see the kid, right? And that family had been in child protection, but it was her brother who had a case. And so when the mother tried to report it to the child protection agency, they said, well, we don't have any evidence, and it's not the boy, it's the girl, and we don't have any evidence. So, you know, I think that is, you know, I've talked with the county supervisor, not specifically about that. You know, she's a good person and a good manager, but this is the kind of the philosophy of this family assessment program that just really, you know, puts too much weight on the rights of the parents and not enough concern for the welfare of the children. Yes, Lisa, I can see. Lisa was also a member of this Child Protection Task Force and is an emergency room physician. So I see you have a question.
I have two questions for Katy and Courtney. One is, do you see anything different given the people that lost the elections and the new people coming in? Do you have any sense that it will be easier, harder to pass the bills that have been put forth? And the second is, do you know what the status is of, and I don't know the name of the bill, but the bill being put forth by the African American lobby?
So I think the biggest change that happened wasn't necessarily as much as people winning or losing elections as different chairs. So Rena Moran had been the chair of the Health Policy Committee before, and now she's chair of Ways and Means. So she's still in a, you know, really powerful position, but she's not chairing health policy. So it'll be interesting to see her involvement. I would assume that she will bring back the African American Preservation Act bill. I don't know for certain, but I know that's just been a top priority for her. So I do think that bill will be back. And I think there's a lot of groups that have weighed in, you know, with concerns about aspects of it, understanding the underlying reason that she wants to do it. But I have not seen it get introduced or have a hearing yet, but I do think that will be back, and Courtney can weigh in if she knows more about that bill. But I think the dynamics are actually pretty similar. I mean, I think given everything that happened in the last year, the biggest surprise is that it's pretty much in Minnesota very similar to where we were before the election. The majorities stayed the same, got a little bit tighter. So the majorities, you know, the majorities are very tight in both the House and the Senate, but still, and all exactly the same leaders from the, you know, in the House and the Senate. Majority leader, speaker in the House are the same. Majority leader and minority leader are the same in the Senate. That's unusual to have an election happen and have all the same leaders. So I think a lot of those dynamics are really the same. I mean, I think the biggest barrier for us is helping sort through concerns about racism in the child welfare system and how that relates to making sure that the right kids that should be taken away from their homes are taken out, and if a kid should not be taken out of their home, that they're not, you know. And we were hearing concerns about kids were getting sent to child welfare by teachers because they didn't have a coat, you know, and things like that. And so it's really overcoming that. And I think everyone wants the right kids to stay in the home if they should and be removed if they should. And it's just figuring that out. And it's really emotionally charged. It's a really difficult discussion. So that will continue this year again, I think. Courtney, I don't know if you have anything you want to add to that.
Yeah, I would just quickly add that with Rena Moran's new position as the Ways and Means Chair, that's a huge committee to be in charge of. And so that bill has not yet been introduced, but it'll be interesting to see if she may have passed it on to a new member, because I know that bill is a pretty heavy lift and involves a lot of work. And with her new chairmanship, it'll be interesting to see if she continues to carry that. That's something I would watch for. And then, as Katy mentioned, with the dynamics, something to really pay attention to. I guess the only real shift is the power that some of those factions are going to have. There are the independent caucus in the Senate is going to be able to sway either way, and they're going to have a significant amount of power as two Greater Minnesota prior Democrats. So that's something to watch. Yeah, the two independent members and other Greater Minnesota more moderate Democrats are going to have a lot of push towards when it comes to the end of the year and the budget. And I think that very similarly in the House, the new House Republican caucus, which is 5 members of the Republicans that are the most conservative members of the Republicans, they're going to have a significant amount of power because they do not always vote with their party. Sometimes they abstain. And the Greater Minnesota Democrats that tend to be a little bit more conservative or more moderate are also going to be ones to watch because sometimes they don't always vote with their party too. So I think those small factions are going to have an outsized amount of power this year with how tight those margins are.
And we also should remember what's called the Posse Caucus, which is persons of color and indigenous. And that is maybe 30 members or something like that who have formed around issues related to those communities. And, going back to Lisa's question, a lot of people aren't familiar with the bill that we've just been discussing for a few minutes. So I just want to just briefly fill you in. This is a bill that Rena Moran, who's now chair of Ways and Means, but when she was chair of Health and Human Services, introduced, and it has provisions in it which say, for example, it's about African-American children, and it's about trying to address racial disparities in the system. So the provisions include, in particular, one that we're concerned about is that any child African-American child who is screened in for neglect should stay in place wherever they are for 60 days while they do a kinship search and get services in place and things of that nature. And, I've been trying to look at the research and talk with experts around the country. And what I came away with is essentially that might be fine for 80% of kids who would be okay for 2 months where they are. But some number of kids, whether it's 20% or 30 or 40%, would not be okay. And we're talking about situations like severe neglect where they're not developing normally, or situations where, they're actually in danger. Keeping in mind that the majority of child fatalities nationally are not from abuse, they're from neglect. And also neglect has very serious long-term consequences, particularly for younger children, developmental damage that you can't really catch up on and things of that nature. So, we have been talking about, modifying that bill to, for example, at least have a very thorough assessment up front before you decide to leave kids where they are. But there's such a strong feeling that child protection is removing people, particularly from African-American and Native American families, with a racist lens, and families that don't need to be removed, that, as Katy says, it's really hard to have that conversation. But those are some things that we've raised our concerns about, or specific things in the bill, even though we understand the overall thrust of it, and certainly support the idea of getting at racial disparities and clearing them out of the system.
So Katy and Courtney, is that bill constitutional? I mean, I agree with looking at all the root causes here, but is it constitutional to have a bill that separates out African Americans only for a certain treatment in child protection? I mean, is it even, if it's not, is it even worth trying to deal with it, in terms of?
I mean, I'm not an attorney, so but I would say the testimony from groups that know a lot more than I do is that they do not think it's constitutional. I think that's one of the concerns that's been raised. We are not the only group that had issues with it, and so we've kind of not taken the front seat to being the ones testifying against it, I would say, because there's others that have really more eloquent arguments, and some related to the constitutionality. So it's something we're watching, and we want to be strategic in figuring how to weigh in on it, because there's other bills. We obviously want our bill to pass too, and Representative Moran is a really key person to try to get on board. She's somebody that we've reached out to and had conversations with about our bill. And as far as the last conversations I know about, she was listening, I guess, to learn more about our bill. She didn't say she had specific concerns about it. So, you know, it's being strategic on making sure that our concerns are communicated and noted, but knowing that there's other groups that I think are, you know, and I don't know right now where folks stand, but I know she was having conversations with the county attorneys and with just the counties in general, on some of the issues and concerns they had about it, maybe more behind the scenes. But, you know, it's difficult for legislators when you've got a bunch of people coming to testify and telling stories about having their kids taken away and they shouldn't have been taken away. And you just don't, no one knows the actual background on whether, I'm sure some of these stories are accurate, maybe some aren't. It's hard for legislators when you hear many of these stories in a row to then kind of go back to the technical, well, is this constitutional? And so these things get momentum sometimes, even if it's not necessarily the way that we would suggest solving the problem. I don't know, Rich, if you agree with that assessment or have more to add.
Yeah, no, I think that was a good question, Lisa. And, you know, I don't know, we just have to play it out and see if we can help, you know, craft it in a way that's going to work constitutionally and also for kids. And I'm not sure we're going to have a major voice in that, but, you know, we're willing to help if we can.
Is there a way that you can think that we could connect on the improving the racial inequity without having it specifically focused on that bill? I mean, some way to build bridges or other bills? I mean, do you have any advice on that? It's a difficult situation in the relationships, I think.
Well, I think you know, our sort of, where we really have some expertise and some ability to have an impact is, you know, our knowledge, and as many of you know, I've worked on the inside of the system as well as the outside, is that what does it take to run a good program? And if you run a good program, you should be able to identify when people are making decisions without realizing, you know, that there's some racial bias in their thinking. And I think that's very common. And it's, you know, what we're basically saying is, well, first of all, you have to have common standards around the state and not have everybody kind of doing their own thing. And then you train to those standards, and then you have to have a quality review system. And that quality review system has to go right down to the granular level. So for example, if you have, this is an example that I think Greg has given me, and I've used it a lot. When I was doing direct work, and when Greg was running his units, you would have a weekly meeting and you would go over the cases. You know, if you were an intake unit, you go over the intake. If you were ongoing, you go, and you'd maybe take, you know, half a dozen of your most complicated situations or ones that you're struggling with. And you go through them. And if you identify that, hey, here's an African-American family that got screened into the system, or that had the child removed, or where we decided not to send the children home. And here's a white family with very similar circumstances. We made a different decision. What's going on here? My experience, and I think the theory of adult learning is squarely, you know, supporting this point of view, is that people don't actually learn to what to do, and they don't change their behavior unless the training gets translated into that ongoing quality reviews, weekly looking at stuff. And then people sort of say, oh, I've seen the pattern here. I get what I'm doing, or I get what my unit is doing. And that's where the change occurs and it becomes, you know, internalized and metabolized. Well, as you can see, that gets into the weeds pretty quickly. But the short version of it is there's no substitute for running a good program. And we have a pretty good idea of the components of what it takes to run a good program, because, you know, because we've done it. So we've done it well and we've done it badly, and we learned the difference. And that's where I think we can be helpful. Does that make sense? I know that was a little bit in the weeds there.
Do you think, have you seen what their agenda is in the training academy? Do you think they have good information about addressing inequity? I mean, that may be important, obviously.
I have the training academy people, the Child Welfare Training Academy got passed like a year and a half ago, for those who don't know, and they've been working on getting it up and running ever since. I think they've done a fabulous job of implementing. It's a very big deal to implement something like this, and they've done a really good job. They're still training people to do family assessment stuff, and we have, you know, basically, you know, had an ongoing conversation about, you got to stop training people to do these things because they're killing kids. You know, I mean, the research nationally, and this is what's happened in the last year, has come out that said 13 states have abandoned this set of practices because too many kids were getting killed. So we're saying that to them, and they're saying, well, you know, we work for the department, we have to train on what they want us to train on. So there's that piece. But by and large, there's a lot of really good content there, you know, on whether it's sudden infant death syndrome or children's mental health or childhood trauma and how to, you know, deal with that. Again, the issue is with adult learning, you can go to a classroom for 3 days, you go back to your desk, and, you know, the research is basically it's got a 72-hour lifespan. You'll forget everything within 72 hours, unless your supervisor supports that training and reinforces it. So if you're there at your desk and you're saying, I can't remember exactly how this worked, and your supervisor shows you how to do it, 2 or 3 iterations of that and you can internalize it, and then you got it, right? But unless you have that follow-up, it's not going to take. So all the training in the world is not going to help with that. You know, it's not going to make systemic change. So that means that all the supervisors have to buy into this stuff and be ready to support it and have the time to support it and not be so running wild, you know, around themselves that they can't help the worker. It means a lot of things in terms of infrastructure that have to be in place. I did some research, you know, quite a while ago now of worker retention in child protection cases. So I think I surveyed like 15 states, something like that. And the big difference in terms of retaining child protection workers, and there was kind of 2 points, 6 months and 1 year. They'd lose a lot of people at 6 months and a lot of people at a year. And the states that did the best were ones that had a senior worker, a supervisor who had a certain amount of their time carved out to mentor workers, new workers. So they had up to a third of their time where there's a senior worker supervisor that was dedicated to, you know, hand-holding and mentoring those new workers. And if they had that, and they came back from one of their first home visits, and they said, oh my gosh, I can't do this work. I just saw this horrible thing. And, you know, then if they can have somebody to support them, to talk them through it, to help them to figure out what to do in difficult cases, they make it, the retention is way higher. So that's a training, you know, a piece of training is to have those supervisors really buy in to what the policy and the practice is, and to be, you know, working it through with the workers until it becomes second nature. Other issues that people are interested in pursuing. I know there are some people that I see who are not quiet people who might have some questions. We got, you know, I see Kathy, you have, you know, points of view on this. You've been doing this for a long time. Not to put you on the spot, but if you have anything, feel free to share. And I know there's a number of foster care providers who are here that I don't know personally, but I'd love to hear your input as well, or your questions.
Well, I haven't talked with you for a while, Rich, but I've been out kind of on the ground gathering a lot of different information, and there's I guess I kind of want to just catch up on where you're at. But one of the things I did want to say is that the special needs children are back in school. I don't know if a lot of people are aware of that. We did have a choice to keep our foster at home, but that started out real strong, but fizzled very quickly. So when Christmas was over, the New Year's, she is back in school. So there is that element too, that some of our children are back. Yeah, I guess I'm just kind of here to see the direction that you're going. And I have a lot of tie-ins possibly in the future of different situations I've been involved in. So good to see everyone.
You too, good to see you again. So yeah, Mark?
Yeah, I'll stick my nose into this again. I brought up the issue of illiteracy. And the reason I do that is that 70% of prison inmates are mostly illiterate. When I talk to the local sheriff and police in my local area, they're quite aware of this problem. So I think of this as a pediatrician as a vital sign, a measurement. And the best time to prevent illiteracy is during the first 30 years, according to some experts. And that's with training parents to work with them. And it's often multi-generational. In other words, the parents don't know what to do with their kids early on. They think the school will teach them to read. And I think when we miss that opportunity, we set up the process of school failure and all of the stuff we've been talking about. So I keep pushing this issue of emphasizing, recognizing, if I were still in practice, one of my vital signs would be parents' ability to read. And I would pay attention to that. So I bring that up again, just as something to think about. How do we integrate it? Most programs that do home visiting don't pay much attention to that.
So Mark, if you don't know him, is a retired pediatrician and is a real advocate for literacy issues. So thanks for bringing that up. I just want to recognize, I've just been reminded that we've gone over an hour. I think sometimes we've gone as much as an hour and 15 minutes, but I want to check with Katy and Courtney, and also anybody who, banked on an hour and needs to go, that's all right. I'm happy to stay as long as anybody wants to talk or ask questions, but I don't want to presume you can go on, so.
What do you think the chances of the foster care bill getting passed this year? Katy, Courtney.
The foster care bill, which one is that?
Sorry, the one with allowing less disallowance for having it to be a foster parent.
I don't know if if I track that one so closely. Tell me more. I have so many bills in my head.
That's
Rich,
all right.
do you know which one she's talking about?
I don't. Say a little more, Lisa.
No, the one that we've been working on with Moses and Ranum and the people over at Hamlin trying to get negotiate.
Yes, that's the one I was talking about initially. I don't know if you were, I think you were on, and I might have been not describing it clearly. That is a bill that's the bill where to reduce barriers to becoming a licensed foster parent by either shortening the time since you had a felony conviction before you become eligible, or in some cases eliminating it, and raised a lot of red flags for us and for some of our supporters, particularly supporters who are former judges and who have seen a lot of cases go through, as well as some of our board. And so essentially, you've been a part of negotiating that, Lisa, and in the last month or so, a couple of the people that we've all been working with have I think brought it much closer to the finish line and reached some agreements that we think we can live with. And it's mostly about some of the ones that were felonies, like termination of parental rights, and where they wanted to have just a 5-year bar. We said that needed to be permanent. Some first-degree violent crimes that were going to be 5-year bars, we said no, they have to be permanent, like armed robbery and arson with intent. In other words, with people inside the building or whatever. So we got a lot of that, I think, cleaned up and got. But the other piece of that is we're trying to say, look, if we're going to do that, we need to have some common standards among counties about how to evaluate, how to assess prospective foster parents, so that we're, first of all, assessing people fairly and based on their current ability to be foster parents, and we're assessing people similarly across the state. So we're working on adding that piece back to the puzzle. Yeah, and actually, Lisa, you and I probably need to have a conversation about that, because I think we want to get you looped back into whatever's next in that, the next leg of that journey. Well, I didn't actually get a response from Katy and Courtney about whether you have to go. I just want to give you permission.
I can stay.
Yeah, I can stay a little longer too. I probably have to jump off in the next by 3:45, but.
Okay. I see Nali Vu, our board members on. You often have questions. I don't want to put anybody in the spot. I just want to make sure you don't get left out if you do want to say something. There you are. Hi, we can't hear you, Nali.
Oh, yes. Hi. Nice to meet everyone. Sorry, I didn't change my logo back. I've been doing Zoom meetings today. No, I don't have any questions today, but I did hear earlier, I think Greg brought up the case about the 2-year-old in St. Paul. Was it Greg? I'm sorry, I can't recall who brought that up, but yes, actually I shared that post on my Facebook yesterday and got a lot of attention. And actually, Rich, I was able to gather quite a few volunteers for future events. So
Very good.
I like 9 pretty solid volunteers. So yeah, but otherwise I don't have any questions at this time.
Great, good to see you. Well, thanks. Yeah, that was a terrible case, and it looks like it was one where there were too many red flags. They may not, shouldn't have reunited those kids. And then when it was reported, the response from Child Protection wasn't quick enough, although 12 hours is not much time. But as far as we know, people have been reporting it for a week. That's part of the response to Phyllis's question is we really can't get at the information about what was known by the Child Protection Agency. So big theme for us is more transparency. I was in government, I was in those, kind of bunkers where, you're at a high enough level that you're really getting shot at. And I believe you're better off just getting that information out there and not trying to, be coy or cute or, you say, it looks like a mistake was made, we're gonna look into it, or no, actually a mistake wasn't made, we followed procedure and it was the right thing, whatever it is, you get it out there and then you get a reputation for being trustworthy. And so the media sort of say, well, if this administration said it, it's probably fair. And so it just works better for you in the long run. I would say Minnesota is not very transparent, at least in human services compared to other agencies I've worked in. And so I think we need to help them with that.
Have there been any progress on the accountability for the workers? That I know in the past, some of the issues that we had dealt with was trying to report and then being overlooked, but then no accountability for the reports not being taken seriously when the child was in danger. Is there, because I know that the workers are they still exempt?
Yeah, I think they're always going to be exempt because, of the nature of that position. But, well, I mean, I think you have to look at that in steps, because the first step is screening in cases or screening them out. And as you, I think, know, based on this Child Protection Task Force, which is ancient history to some people, it's not on the radar anymore. But we went from only 27% of cases, reports, being screened in for service, which was, the national average was around 60% at that point, to 45%. So that's brought in about 15,000 more kids per year. We're still not up screening and responding to as many reports as nationally. But that's a significant improvement in my view, because a lot of those kids those are pretty serious cases. Some of them we reported multiple times. But it also drove a lot of new money into the system, because when those cases get in, the case management is, for most of them, 50% federal eligible for those costs. So basically $400 million in new money has come into the system by the Medicaid route because of the new kids coming in the system. And that's why there's 400 more caseworkers on the ground. So that's some of the ripple effects. So that first step, I think, caseloads, according to DHS, and again, you can't actually get a count. You'd have to go county by county, and we don't have time to do that. And they still might not give it to you. I mean, I spent 6 months trying to get, a caseload number out of Ramsey County once and gave up. So, but according to the department, caseloads have gone from about 20 statewide to about 12 in round numbers. So that's all being driven by that one standard of reporting the same, of responding the same way to maltreatment reports. But the next step in the process is which families go to family assessment and which go to traditional investigation. We're still over 60% of those cases being sent to this family assessment, which is kind of, I think of it as child protection light. And many of them are closed still at the request of the parents, so there's no accountability there. But the research now, and this is some of the research that's come out in the last year, is that if you assign more than 1/3 of cases to family assessment, you're assigning high-risk cases to that are inappropriate. So you're putting high-risk cases in a low-risk bucket. So that's not an accountability piece that I would say Kathy. And then when it comes to ongoing casework, we have situations like Autumn Hallow or the 2-year-old that was murdered. Nothing has changed really. We don't have standards. We don't have agreement on what the standards should be. So something like visiting the children once a month and talking to children separately from the parents, if it's an in-home case, we're not doing that consistently around the state. And then you'll get, I talked to somebody who was talking about a small county, McLeod County, that said they do all that stuff, they do it great. So the issue is inconsistency. It's not, some counties are good. I mean, ironically, there's a lot of issues we have with Hennepin County, but they're the most transparent. They'll tell you what's going on. They'll tell you what, they'll give you information and they'll have a conversation with you. Whereas other counties that might be doing really good work are not willing to, just kind of engage. So it's really, that's the issue, is consistency to me. That was a long answer, but
I need to jump off, everyone.
Okay.
Thank you for having me. Please continue the discussion.
Sure. Thank you, Katie.
Thank you.
Well, maybe we ought to call time on this, wrap it up. It's been a great session. I appreciate all the new people who showed up. I hope you show up to the next ones. We're going to try to have a really interesting set of webinars this year, and I think you'll find them good. So
What's the date?
what's that? Every 2 weeks. So the next one is whatever that is, 2 weeks from now. The 27th is Dave Pinto, and I don't have the other ones quite pinned down yet. We're working on that. All righty. Well, thank you, everybody. Have a good rest of your day. We'll see you in a couple weeks. All right. Bye-bye.
Thank you.